Ghana introduced the family planning concept to help families plan their lives and also check economic growth. Decades after its implementation, a visit by News 24 to the Accra Sub-Metro has shown that some women are still not keen in using the available methods because of the alleged side effects. Another report by Gifty AJ.
Methods simply give women and girls key opportunities: when to have a child, the number of children to have, and the age intervals among babies. Abstinence, experts say, is the only birth control method that is 100% effective in preventing pregnancy as well as sexually transmitted diseases. Since most sexually active people could not adhere to this principle, Government of Ghana's support for family planning programs began in 1969, with some of the major initiatives being the Contraceptive Social Marketing Project, the Ghana Family Planning and Health Program, and more recently, the Ghana Population and Needs Project. The initial focus of these projects was to increase demand and utilization of modern method for family planning through social marketing. Over 4 decades of family planning implementation, stakeholders in the industry say the campaign is yet to achieve its set target.
People are now accepting the methods, but just that our coverages are low. For first quarter 2012, we set a target of 7.5, but we'll be able to achieve 7.2. And 2011, our target was a little high. We had 12%. And we achieved 7%. 2010, we had a higher target of 25, and we achieved 4.6.
As at 2008, the figure the percentage we had was 17%. So I think it's fairly good. It's not bad, but we are still working on it. The next assessment, we would know if we've gone up or we've reduced. But we all hope that it goes up.
A SNAP survey revealed mixed experiences. Whereas Kofi stated he will allow his wife to use the method, Erica says using it has enhanced her sexual life.
Although I enjoy sex, I don't want her to be forming a football team around and to be giving birth to an age I can't take off. So I want to take off my children. So 2 or 1 is okay for me. I don't want to pollute the system. So maybe we're using contraceptives and other methods so that she can't give birth. But that's for the sex to be going on.
Family planning is good. It has helped me a lot. When I started using the injectable, everybody said I was looking beautiful.
However, Coco and Comfort, who used it previously, say they had to discontinue because of various degrees of pain and discomfort they experienced.
I used the 3 months injectable. I wasn't menstruating. I also had pains in my lower abdomen.
When I used the pill, I became fat. I could not walk well. I also had problems breathing.
Ironically, Safia Muhammad, who had not used any of the method but have heard negative stories concerning family planning, told me that she rather uses a medicine given by a friend without knowing the name.
I learned that when one is on the pills, she will finally get fibroid. Not only that, but a whole lot of diseases.
What then accounts for the side effect some group of women experience?
There is something little in the hormones that makes the woman put on. We don't call it a side effect. We just call it a minor discomfort. Because it comes as a new thing has been introduced into the body. The body will react to it. It is just for some few months, some within 3 months, then everything settles, and then the woman can just use it as long as she wants to.
With health officials confirming the purported side effect, I asked whether it can be controlled.
It can be managed if the woman is able to eat and eat well, at the right times. More vegetables, more fruits, especially most of the women who are on some of the methods, they do have this spotting bleeding or intermittent bleeding. And if the woman is able to eat a lot of fruits, it regulates that.
Ghana National Population Policy of 1994 includes the following objectives: to reduce the total fertility rate to 4.0 by 2010, to increase the modern contraceptive prevalence rate to 28% by 2010, to achieve a minimum birth spacing of at least 2 years for all births by 2020. However, 2010 figures from the World Bank indicate that the fertility rate of the country is 4.2 and the contraceptive prevalence rate stands at 24%. Stakeholders say for Ghana to achieve the 1994 population target, a lot more needs to be done, particularly in terms of public education, highlighting the benefit of family planning method. Current statistics from the Ghana Health Service reveals that family planning component of maternal health in reducing maternal mortality rate in Ghana recorded a continuous decline in its acceptor rate from 42.1% in 2009 to 34.7% in 2010, a further decline to 28.1% in 2011. This means that stakeholders in maternal health need to double their effort.
There's that peace of mind that one have, because you are always ready when your husband is ready to have sex with you. You are able to satisfy that, and that brings a lot of peace in the home.
You have an issue of mortality in the country, so if a woman is on the family planning method, it's also kept that issue.
A woman's health is the wealth of the family and the wealth of the nation. So if the woman decides to go on a method in order to help herself, able to live and live longer to take care of her children, I think that is what we are looking at. If the woman is happy, the family is happy. If the children are happy, the whole family is happy. And it affects the man as well.
Available methods include the male and female condom, the pill, injectables, IUD, cervical cap and vasectomy. As women groups are calling for greater participation of women in socio-economic development, perhaps it is time women and girls look at the health benefit of family planning methods. Gifty AJ, GTV News.